Miscellaneous viruses, papova viruses, papilloma viruses. This is isosaccharidyl 55 nanometer diameter non-enveloped virus which contains double stranded circular DNA. There are 100 types of human papilloma viruses. Diseases: cutaneous wart, genital wart, recurrent respiratory papillomavirus, oral papillomavirus, cervical cancer. These infections are transmitted by indirect or direct contact, including sexual contact. Laboratory diagnosis: the histology and cytopathology, electron microscope, immunocytochemistry, detection of viral nucleic acid by polymerase chain reactions. Prophylaxis: the quadrivalent HPV human papillomaviruses vaccines have been recommended for girls and young women of 9 to 26 years of age. 3 doses, 0.5 ml each, are given intramuscularly. First dose is administered at age 11 to 12 years, may be started at 9 years. The second dose is given 2 months after the first dose, and third dose 6 months after the first dose. The bivalent human papillomavirus vaccine is also available. 3 doses at 0, 1, 6 months are given. 0.5 ml is given intramuscularly. Polyoma viruses. The polyoma viruses are non-enveloped 42 to 45 nanometer diameter with 72 capsomeres, isosaccharidyl capsids. Viral genome is double-stranded DNA molecules. Different polyoma viruses: mouse polyoma viruses, simian viruses 40, JC polyoma viruses. It causes a progressive multifocal leukoencephalopathy. The BK polyoma viruses, it contains renal disease. The Merkel cell polyoma viruses, it has been established as cause of Merkel cell carcinoma, a rare skin cancer of humans. Laboratory diagnosis: electron microscopy, the viral antigen detection by immunofluorescence test or ELISA, the viral nucleic acid detection by ELISA, viral nucleic acid detection by DNA hybridization and polymerase chain reactions. Cytopathology: the parvoviruses belong to the family Parvoviridae. They are very small, about 20 nanometer, non-enveloped isosaccharidyl virus containing a single stranded DNA. They may cause diarrhea in humans. The parvovirus B19, it has an affinity for immature red cell precursors. It has been shown to be associated with aplastic cirrhosis in sickle cell disease and non-hemolytic anemia. It may cause a fifth disease, which was the fifth in old lost of a sixth exanthematous fever of children. It may cause a fatal erythroblastosis fetalis with hydrops in pregnant women. Laboratory diagnosis: virus isolation, detection of nucleic acid by hybridization technique or by polymerase chain reactions. Antigen detection by ELISA or indirect immunofluorescence. Antibody detection by ELISA. Coronavirus, these are spherical or pleomorphic, medium size, 100 to 150 nanometer envelope RNA viruses containing petal or club shape papilloma on this surface. They belong to the family Coronaviridae. Only 2 species of genus coronaviruses: human coronavirus 229E and human coronavirus OC43, are responsible for human respiratory diseases. Laboratory diagnosis: isolation of virus, demonstration of antigen by ELISA test, antibody detection by ELISA. Severe acute respiratory syndrome, SARS. It is a respiratory disease caused by the coronavirus type name severe acute respiratory syndrome related to coronavirus SARS-CoV. It belongs to the family Coronaviridae. This coronaviruses may be a recombinant of some animals and human coronaviruses. This coronavirus is different from other coronaviruses. The SARS spread by inhalation of virus present in the respiratory secretion of patient. The incubation period is 10 days or less. The death occurs due to the respiratory failure. Laboratory diagnosis: then the nasopharyngeal swab or aspirated throat swab or stool specimen may be collected for laboratory diagnosis. Serum is used for antibody detection. Reserved transcriptase PCR, RT-PCR. The virus's clinical specimen can be cultured on vitro cell lines. Antibody detection by ELISA or indirect fluorescence test. arena viruses. Several rodent-borne hemorrhagic fever viruses are classified on as arena viruses. The viron are spherical or pleomorphic, 50 to 300 nanometer in diameter, and contains a single center RNA genome. They possess an envelope. A man gets infected by contact with the excreta, urine, or feces of infected rodents. Arena viruses causing human diseases. The lymphocytic corium meningitis, LCM viruses, Lassa fever viruses, South American hemorrhagic fever viruses, Junin virus, Macupo viruses, Narito viruses, laboratory diagnosis, virus isolation, the antigen detection by indirect immunofluorescence, antibody detected by indirect immunofluorescence test, Ruby viruses, rubella or German measles is primarily a mild childhood disease. It may be acquired congenital or postnatally. Morphology: the rubella virus is a pleomorphic, roughly spherical, some 50 to 70 nanometer in diameter, envelope RNA. It has a single center RNA genome. Disease: postnatal rubella, congenital rubella. Laboratory: the routine diagnosis of rubella is not called, but for laboratory diagnosis becomes important for in pregnancy women suspected to have rubella. Diagnosis can be established by virus isolation on serology. Prophylaxis: the live attenuated vaccine RA 27/3 strain grows in human diploid cell is widely used. It is administered by cutaneous injections. A combined measles, mumps, rubella (MMR) vaccine is recommended for all infants at the age 15 months, followed by the booster at age 4 to 6 years. Rio Verde. The name Rio Verde is derived from the by respiratory enteric orphan virus because of the frequent occurrence in respiratory and enteric tracts. It was considered an orphan as it pathogenic to human was not proven. The rotavirus, a member of a family Rio Viridae, is recognized as an important cause of gastroenteritis in children. Rotaviruses are the commonest cause of gastroenteritis in children. The rotavirus is a double-shelled icosacral capsid resembling a wheel with short spokes radiating from wide hub to clearly defined outer rim. The genome consists of a double-stranded RNA, double-stranded segmented RNA. The complete rotavirus particles is 65 to 70 nanometer in diameter. There are 7 serogroups A to G. Most human rotavirus falls into serogroup A. The human rotavirus does not grow readily in cell culture. The rotavirus diarrhea is usually seen in children below the age of 5 years, but it is most frequently between 6 months and 2 years of age. The infection is acquired by fecal-oral route. Disease is self-limiting. Laboratory diagnosis: demonstration of virus particles in feces by ELISA, latex agglutination, counter current immunoelectrophoresis, electron microscope, immunoelectron microscope, antibody detection by ELISA, polymerase chain reaction. Virus caused by gastroenteritis: rotavirus, norvox virus, adenoviruses, astroviruses, coronavirus. The viral hemorrhagic fever: the the hemorrhagic manifestation may occur in patients suffering from several virus infections. This includes exanthematous viruses, smallpox, chickenpox, measles, mosquito-borne viruses, yellow fever, dengue, chikungunya, tick-borne viruses, Kia Sanur forest disease, worms hemorrhagic fever, Crimen Congo hemorrhagic fever, arena viruses, Lassa virus, South American hemorrhagic fever, filoviruses, Marburg viruses, Ebola viruses, Hanta viruses, Belgrade viruses, Seoul viruses. For details, these viruses refers to respective characters. Slow virus diseases: a number of viruses agent causes a slow infection in animals and men. It is characterized by a very long incubation period, slow course, predilection for involvement of central nervous system, and terminating fatality. Slow virus disease may infect animals or human beings. Human infections: Creutzfeldt-Jakob disease, CJ disease. CJ disease causes by the prion. It is susceptible pre-senile encephalopathy characterized by the progressive dementia due to the bronchiform degeneration of brain. It may be accidental transmitted to man from corneal transplantation or neurological procedures. Kuru. Kuru is caused by the prion. It is a disease which occurs only in Firo tribe of East Highland of New Guinea. The incubation period is 5 to 10 years. It is transmitted by the tribal practice of eating infected brains of relatives after ritual non-sterilizing cooking. There is a generative of gray matter of central nervous system most marked in cerebellum. The disease ends fatally in 3 to 6 months. The disease is predominantly seen in women and children because only they protect the brain of carcasses. The disease has disappeared following the prohibition of ritual cannibalism.